I'm Dr. Prash Patel. Primarily, I'm a GP, and I've been a GP here in Sunningdale. This is my practice. This is my consulting room since 2004. And then I was made a partner in 2005. It started with an email like anything else. And I think originally it was all a case of, do you know any GPs? So to cut a very long story short, not only did I know the GPs that I think he was thinking of, but a GP with a kind of a GI, a gastroenterology specialist interest. So I just basically presented myself. So James introduced me to Farid, introduced me to the whole, I guess, surgeries and the concept of LumenEye. I was bowled away, if I'm honest with you. They've taken this incredible piece of, I guess, near patient diagnostics, and they have retrofitted it for a modern age. They've given it high definition technology. They've given it a sort of usability where, for me, the cogs started whirring. The idea of bringing this type of diagnostics back into general practice, back into primary care, right back into an office like this was incredibly exciting. I think the bit that really elevated it was not just, the equipment, not just taking, a traditional sort of kind of introducer and this, for me, this, I don't know, this kind of technical piece of kit with the camera at the end, etc. But it was the way it connected up to the chip software. This idea that, especially when I did the very first LumenEye, the idea that I can dial into a colorectal surgeon or to a consultant gastroenterologist, and I can be scoping a patient. I can be curious about something I found. I may not have the expertise or the specialist knowledge, but I can dial in, and I've got a specialist, I've got a consultant who is seeing the very live images that I am and has the ability to consult with the patient was remarkable. So we kind of, when we kind of got to that point, and when we did that very first investigation with that very first patient, and we did exactly what I've just described, that was remarkable. There was an immediacy to the way I was able to deal with that patient's anorectal symptoms. There was an immediacy with which the patient became reassured that not only were we seeing something that he'd only presented to me 24 hours before, but he was getting a procedure done in his own practice that traditionally he would have thought 2 or 3 weeks worth of waiting. He would have to go into a hospital, he'd have to have all the paraphernalia. But then that third element, where I've actually got a colorectal surgeon live discussing the case with me, was remarkable.